Meanwhile, the Trump administration is slashing the United States childhood vaccine schedule.
Health officials will recommend that kids get 11 vaccines, and that's down from 17. Some public health officials worry about those consequences. Here to talk more about what that means for health care is Dr. Anahita Dua. Dr. Dua is a surgeon and founder and chair of Healthcare for Action. Thanks so much for being with us this morning.
It's a pleasure to be here. Thank you for having me.
So what is your reaction to this cutting of the number of vaccines that are recommended for kids?
Well, of course, it raises concerns in the medical community. It's not really about the vaccines themselves. You know, when we say we're going to cut them or we're going to give them, it doesn't necessarily mean that people are covered, because the issue is really about the fact that we need to take the moment to give the vaccines when we have the population in front of us. The logic behind why they cut the vaccines was, well, other countries are doing this that are also first world countries. And that logic is what we really take issue with, because these other countries that do in fact have the 11 vaccines versus the 17, those countries have other different ways of ensuring that their population are appropriately covered, which we do not have here in the United States. So to answer your question in just a sentence, I worry that we are now going to miss opportunities to cover people for vaccines that we need very high herd immunity for. This is going to result in more people getting sick and potentially children dying.
Want to compare, because we hear so much about the Denmark system in terms of these changes. So when you look at the populations of the U.S. and Denmark, there's a big difference. 343 million people in the U.S. compared to 6 million in Denmark. We know the schedule for these vaccines is tailored to a much larger population. When it comes to doses, the U.S. schedule includes 72 total vaccine doses. Denmark's totals just 11. And they also target different diseases, right? The U.S. vaccinates folks against 17 diseases. Denmark targets about 10. RSV, one of the ones that Denmark does not vaccinate for. When you talk about who is at risk, I know you mentioned kids, but is there a subset of children who are most at risk? Is it those who are maybe socioeconomically disadvantaged compared to others?
There are definitely people that are at higher risk of getting the virus, but then of course these same kids are going to school with the other children. These same children are being exposed at clubs and et cetera with other children. And you made a good point about Denmark in the sense that we're talking about really two different, again, ecosystems. You know, in the United States, for example, aside from the fact that we have a much higher population, is that we also had a very heterogeneous population. And what that means is that we've got people coming and going. We've got a high level of international travel. We have pockets where people are much less likely to be vaccinated versus places where they're higher vaccinated. And if there's travel in these spaces, which of course there are, because we don't have laws between states, you are going to get exposure. So the fact that you're talking about a different system is really important. The final thing to mention is, of course, health in general. In these communities that are smaller, they usually have systems where they can quickly respond to an outbreak. In the United States, we do not have a coordinated system for many reasons. And so what that means is, if you want to take an example, if we had a very strong military, maybe you wouldn't need to go and fortify a fortress to be ready to fight something off. But if you did not have a strong military, in other words, if you don't have that healthcare system that can coordinate, it makes sense up front when these children are in front of you in the hospital post-birth to give them the vaccines to ensure that they are going to have the appropriate herd immunity once they go out into the world, because that might be your only chance to give them the vaccine. And that's not the case in some of these other countries like Denmark that have wonderful public health systems and a high level of trust in those public health systems.
Let's go back to the Hill for just a second. And Louisiana Senator Bill Cassidy is a doctor. Here's what he had to say about this. Here we go. He said, sorry, you're going to hear from me, not from him. This vaccine schedule is not a mandate. It's a recommendation giving parents power, changing the pediatric vaccine schedule based on no scientific input on safety risks, and little transparency will cause unnecessary fear for patients and doctors and will make Americans sicker. That's something you've already alluded to. And, you know, I hear what he has to say. I hear what you have to say. And I would love to really back this up to the beginning. Why were vaccines so important in the first place? And what kind of a difference did it make to the lives of Americans?
Oh, we have phenomenal data to respond to this question. Essentially, vaccines have been the primary thing that has reduced childhood death in the United States over the last 100 years. In fact, if you go back 150 years, 1 in 5 children would not make it to their 5th birthday. And the vaccine schedule and allowing vaccines to be something that are super trusted in the community, given out appropriately, cheap, and available has been the primary thing that has allowed our children to survive. The problem with saying that, hey, you can go have a conversation with your doctor, or you don't have to do it right now, come back and we'll talk about it. These sorts of things sow distrust in vaccines. And if you're distrusting of vaccines, you're not going to say, I'm going to be distrustful of this one, but not of that one. It's just going to be an overall distrust. And what that will lead to is parents saying that even the vaccines that are being mandated, that are being said, hey, you really should get this, people are going to be concerned about, because no one wants to hurt their kids. And the minute that you have a question and somebody says to you, okay, you can go and think about it, you are going to take that opportunity to go and potentially think about it and never come back. And that's going to lead to a different herd immunity that is in turn going to affect everyone in the country. So it's not a matter of individual rights. It's a matter of the entire country ensuring that they're at a level of safety. And the government is responsible for ensuring that for our patients.
Doctor, the last question we have for you is, we know your group helps to elect lawmakers who have healthcare backgrounds. In this day and age, why is it so important that you have lawmakers who are making these policies, who are putting people in place to make these policies, that do have an understanding of not maybe just the health background of things, but just the scientific process and how science works and is understood?
Well, you hit it on the head. You really need people who get it, not in terms of just the science and in terms of just the medicine, but also in terms of the logistics. If I have the best drug in the world, but I have no way of giving it to the population, I've not done anything. Doctors, nurses, healthcare workers in general have lived and worked and breathed the ecosystem that we have in the United States that allows our patients to get healthier. And this system is extremely complicated. So when you have people that can go to Capitol Hill, that can actually sit down and be a part of making the laws, they understand the nuances that can ensure that not only the science is put forth, but also the dissemination, also ensuring that you can check scientifically to make sure that what you're doing actually has the right outcome. And so having those sorts of people that are like-minded, who can have a conversation, defend their positions, and also hear the other side is really important now more than ever. You know that right about in the next month, we're going to have another conversation about the budget that's all surrounding healthcare. So you need people up there on the Hill who know what they're talking about and who understand how to talk to the public about it. And that is why now more than ever, Healthcare for Action wants to put those types of people in office so that they can make America better.
Dr. Dua, thanks so much for joining us again. It was great to have you.
Thank you very much.
Thanks.